I think I am the only research person uh, who is belong to different profession, that is pharmacy. Still, it is an honor to stand before you today on the occasion of International Yoga Day that became a global celebration of a timeless tradition that connects the body, mind, and spirit. I am a pharmacy professional, so I have witnessed the role of modern medicine in saving lives. But today, I'm grateful that I got this opportunity to emphasize the synergy between the pharmaceutical science and the ancient wellness system like yoga, especially in the prevention of chronic disease such as breast cancer and other lifestyle related disorders. So when the topic of this webinar is women health, yoga for women health, and when I saw the topics, I found that the topic that relevant to my field is yoga for prevention of breast cancer. Each I spent 5 to 6 hours in my research in that particular field. So let me begin with the hard truth. Breast cancer. It is the most common cancer nowadays in worldwide. So according to the WHO, nearly 1 in 8 women will be diagnosed with breast cancer in their lifetime. So what are the reasons? Because in this current scenario, we are hearing every day we are getting this news. Some one is suffering from breast cancer, diagnosed with breast cancer. So what are the reasons? So genetics play a major role, no doubt. But before to that, age, obviously after menopause, generally the women are getting menopause after their 40s. So after the menopause, it became the high chance for the breast cancer. And also 70 to 80% of the breast cancer cases are influenced by lifestyle factor. Yes, we cannot deny the family history. We cannot deny the sex, age, and genetic. But also, we will agree that 7 to 80% reasons of the breast cancer cases nowadays are influenced by lifestyle factor. So, what are those lifestyle factors? Physical inactivity, obesity, stress, poor diet, and exposure to toxins. So, here, this is where the yoga steps in, because I am a pharmacist. I believe in modern medicine always. I studied about medicine starting from its formulation to its export, manufacturing, etc. But yoga, it is came as not an alternative, but as a powerful complementary preventive tool. So yoga is what we believe. What we believe that yoga is not just about flexibility or fitness. It is not about the stay fit only, but it is a science of life. It addresses the root cause of many diseases. Example, that yoga regular, if you practice yoga regularly, it can reduce your chronic inflammation. And the topic, as my topic, the session, I am just delivering the yoga and prevention of breast cancer. So if you will see, the main reason of breast cancer in women are the hormonal imbalance. And what are the hormones? Majorly the progesterone and estrogen. So yoga also can address to this hormonal imbalance also, as well as oxidative stress and mental illness. So for hormonal, to manage your hormonal balance and also detoxification, certain yogic postures stimulate the lymphatic system also, and it supports the detoxification. So yoga helps maintain healthy estrogen level, and that is the key point in breast cancer prevention. If your estrogen and progesterone levels are in normal now, so you are in a safe zone. But what happens after menopause, after crossing the 40 age of 40, this estrogen and progesterone levels used to generally fluctuate. So there are some yogic posture. For example, Ardha Machandrasan, that is called spinal twist, Bhujangasan, Cobra pose, Setu Bandhanasana, that is breeze pose. So these poses, what they do, they promote blood flow to the breast region and reduce stagnation of lymph. Similarly, obesity. Coming to the point, obesity is a major risk factor for breast and other cancer. Yoga, when you practice yoga regularly, it increases metabolism, improve digestion, and adds sustainable weight management also without side effects. So for a effective weight management, you can do Surya Namaskar, boat pose, that is I think called Naukasan, Kapalbhati Pranayam. These things you can do. Then stress. So nowadays everyone is overstressed. यू कैन अकाउंट आप एक वर्किंग लेडी को एग्जांपल ले लीजिए जो 9 to 5 ऑफिस में जॉब करती है, या फिर आप एक हाउसवाइफ को भी ले लीजिए. स्ट्रेस आजकल सब इससे ओवर स्ट्रेस हो चुके हैं नाउ करंट सिनेरियो. सो दीज क्रोनिक स्ट्रेस ना लीड्स टू यू इन्फ्लामेशन, weaker, that can weak your immunity, that can imbalance your hormone also. So what yoga does, the yoga calms the nervous system, reduce cortisol. Cortisol is a stress hormone that is enhance your stress level. So by doing yoga you can reduce the stress level also. So some recommended practice for these things to reduce the stress, you can do anulom vilom, you can do yoga nidra, and every day you make practice of doing at least meditation for 5 minutes. Start from short span of time, you can increase it gradually. Meditation everybody should do. Now coming to the, in case of cancer, what is this? Is the abnormal growth. What is cancer? These are the abnormal growth of the cell, abnormal, uncoordinated, untimely growth of the cell. So that is the inflammation. So there are now specialized cells present inside our body that is called natural killer cells. What cells these cells do? These cells generally act as a defense system against abnormal and cancerous cells. So by doing yoga, they can enhance the activity of these natural killer cells. For getting this benefit of this natural killer cell, you can do some type of yoga. For example, Dikshasana, that is called tree pose, Trikonasana, triangle pose. You can do also Brahmari Pranayam. These types of yoga posture we can adopt. Then these are about the cancer, but apart from the cancer, there is also yoga for effective and preventing and managing. There are many chronic diseases. For example, diabetes, hypertension, cardiovascular diseases, polycystic ovarian syndrome, that is called, many women are nowadays facing this type of problems, PCOD. We call it PCOD in medical term, we call it PCOD, and anxiety and depression also. Apart from these, your yoga improves medications, adherence, enhance quality of life, and reduces healthcare burden also. So coming to the, I am as a pharmacy professional, we generally focus on medication, but also we bear the responsibility for promoting preventive care. एक बात कहते हैं ना, prevention is better than cure. So today the healthcare model is shifting from sick care to wellness care. So yoga and Ayurveda are being integrated into clinical protocols. So nowadays what we are doing, we are integrating yoga and Ayurveda, and they are becoming the clinical protocols and community health programs across the world. So let us envision a future where patients are educated about yoga as part of the disease prevention. Being a I belong to a medical professional. So what I wish that every patient who are coming to a hospital, clinics, so they should be educated about the yoga. That is a part of a disease prevention. I am not assuring you, I cannot tell you that yoga will completely cure, but definitely it will prevent. Yoga is prescribed alongside the medication for chronic disease. It should be done. So yoga becomes the parts of your life. So at last, I can say yoga is not just a practice. It is a way of life that empowers us to take charge of our health. So breast cancer and many chronic diseases are not just treatable, but often preventable when we act early, live mindfully, and move consciously. तो ऐसा नहीं है कि ब्रेस्ट कैंसर कोई भी क्रोनिक डिजीज ये ठीक नहीं हो सकता है. If we detect it early, if you take the preventive measures, then it should be curable. So let us, as pharmacy professional, advocate for integrative health where yoga, diet, medicine, and education, the four pillar. You can yoga, diet, medicine, and education work hand in hand. Let us not wait for illness to strike. Let us make yoga a part of daily life and a pillar of preventive care. So thank you. Wishing you all a healthy body, a peaceful mind, and a purposeful life. Happy International Yoga Day, and thank you to the organizing team for inviting me to this platform, giving me this opportunity. I'm really thankful to all of you.